Hi, I'm Peter Jordan. I'm the Director of Emergency Services for Eastern Health. My emergency doctor are a company that we've partnered with, a really exciting project where we're using telehealth during peak periods for our emergency departments to enable us to provide additional upfront senior assessment of patients who are not critically unwell but certainly need to be in the ED and have concerns about acute problems. So patients who come in with these issues usually wait a long time because their triage category may not be most urgent. So with this project, what it means is we can quickly get those patients into a dedicated room, have a chat to a very experienced doctor who can quickly work out what their problem is, provide some advice and often ongoing treatment. They can send the patient a prescription, they can organise follow-up tests, but if they find that there's something more serious that needs further investigation or acute care, then they can hand over that care to one of our doctors who can then continue that care as required. We're rolling this out at all of our EDs. It's been in place at Box Hill for 6 weeks, Maroondah for 3 weeks, and next at Anglers. So the fantastic thing is that our experienced doctors can focus their energy on the most unwell patients. So the resuscitation patients, patients having heart attacks or trauma, can be occupied with those patients rather than looking after patients who don't need that advanced therapy. It's really, what we've found is that we can predict when times are really busy, so out of hours when it's difficult to get into a GP. And we know that when COVID cases aren't very high, that patients start coming back to emergency departments in large numbers, and we really struggle to provide timely care. So having this available to us now when things are just getting busy after the latest COVID wave will be really helpful to get people in and out of our ED as quickly as possible.